can do to help a man with erectile dysfunction, I regard a penile implant as the best option for them. It's the only way we have of fixing their problem. It's the only way of having a spontaneous erection that they can use as often as they like. There are no limitations on how often they use it. There are no limitations on how hard they inflate the penis. All the other treatments we have either have side effects associated with them, may cause other damage to the penis, such as scarring from injections, and are certainly not spontaneous. And spontaneity is really a very important issue to men and their partners. They want their sexual activity to be as natural and normal as possible, the way it used to be, and they don't necessarily want to plan and say, gee, I need to take my tablet an hour beforehand, or I need to go and get my injections out and use them. So I have no doubt in my mind that for the majority of men, a penile implant is by far their best option to fix their erectile dysfunction. Some of the areas that are not so well recognised when men have erectile dysfunction are the other effects on the man and their partner. It's well recognised now that men with erectile dysfunction lose self-esteem, they have a higher rate of depression, there are more relationship breakdowns. So it is really a condition that affects the man and their partner, and it affects the man in other ways as well. And I think we need to really be aware of that when we're discussing that with men. Certainly it's great if their partner comes along and is involved in that open discussion about what's happening in the relationship, why the man has the problem, how we can fix it. I think it's really quite important that the partner understands that this is not something that's their fault or their man's fault. It is a condition that's developed. And I think it's also important that they know the range of treatments we have available and are actively involved in the decision. Certainly putting a penile implant is not something that's done just for the man. It's done for the man in his relationship. So if we can involve the partner early on, I think it really cements and reinforces this as a relationship issue, and that there is more to this than just allowing the man to have a stiff penis. A penile prosthesis is really the one thing a man can do that will guarantee that he has a rigid penis when he wants it. It's completely under his control. He can pump it up as much as he wishes. He can make it as rigid as he wishes. So certainly if penile rigidity is important to the man, and indeed there are now several scientific studies that show that penile rigidity is important both to the man and his partner in terms of sexual satisfaction, then undoubtedly a penile implant gives him the most rigidity. Men sometimes wonder why they should have a mechanical answer to their problem. Now, a way to perhaps think about that is if you had arthritis in your knee, you've got the option of putting up with the pain and discomfort. You can take tablets that will help the pain and discomfort. You can have physiotherapy treatment. You can have injections of cortisone into the knee joint. And all of these are ways of overcoming the problem. The only way of fixing bad arthritis in your knee, however, is to have a prosthesis or a total knee joint replacement. Now, I think in many ways that's exactly the same argument men should consider if they've got erectile dysfunction. They can put up with it. They can take tablets that will help it. They can use injections into it. They can do all those things. But the only way of actually fixing the problem is to have a penile prosthesis. To my mind, men are very happy to consider having an artificial knee joint put in if they have bad arthritis and if it's affecting their quality of life. And yet here's something else that affects their quality of life that can also be fixed with a prosthetic operation. Erectile dysfunction is very common in our community. The older a man is, the more likely he'll have the problem, but even men in their 40s have around about a 1 in 30 chance of having erectile dysfunction. Men in their 60s have about a 1 in 12 chance of having erectile dysfunction. So it's certainly a very common condition, and a man who's suffering with erectile dysfunction certainly shouldn't consider himself as being unusual. There are a lot of men with the problem, and they certainly should seek help. Erectile dysfunction really means that the messages from the brain are not allowing blood to get through to the penis. So if you have anything that upsets the normal mechanism, you can get erectile dysfunction. The most common causes of erectile dysfunction are not enough blood getting into the penis because there's damage to the vessels that take the blood into the penis. It's exactly the same as men get narrowed heart arteries that cause coronary artery disease, or narrowed arteries to other parts of the body. So erectile dysfunction most commonly is part of what we call vascular disease, and vascular disease is commonly associated with risk factors of smoking, being overweight, having high blood pressure, having high cholesterol, and having diabetes. So men that have those conditions are at much more risk of getting erectile dysfunction, and indeed at much more risk of getting vascular disease in other parts of the body. Then there are certain what you might call specific causes of erectile dysfunction. If the nerves to the penis have been damaged by surgery or trauma to the pelvis, for instance after removal of the prostate for cancer, then a man may have an erection problem. If the penis is abnormal in some way, particularly a condition called Peyronie's disease, the man may have trouble getting an erection. If the man has a disease of the nervous system, such as a stroke or Parkinson's disease or multiple sclerosis, he may have a problem getting an erection. So we've really got the general vascular disease issues that are associated with the risk factors I mentioned before, and these more specific causes. Really, there are several treatment options available for erectile dysfunction. A man can just put up with the problem and accept it, and for some men that's all they want to do. They perhaps want to know why they have the problem, but then they won't do anything about it. But if a man's seeking treatment, his options really are to use oral medications, and these are the commonly known drugs that have been around for some years now, taken orally half to 1 hour before the man wants to have intercourse. They enable the blood vessels in the penis to open up to cause an erection that way. They don't work unless there's sexual stimulation, and they certainly won't work for all men, and there is a delay from when you take the tablet to when you get a benefit. The other commonly used treatment is to use injections into the penis, where a man learns to inject a medication directly into the side of the penis, and that medication enables the blood vessels to open up and cause an erection. Will work for a lot of men, but it's not a very popular treatment because of the discomfort associated with the injection, the fact that you need to actually physically do something to obtain an erection, and it also has the issues with potentially causing scarring and damage inside the penis, and that may stop the injections working ultimately, or damage the penis to such an extent that other treatments such as a penile implant won't be as satisfactory. Some men are prepared to use what's called a vacuum device, which is essentially a plastic tube that goes over the penis. It has a pump attached to it that enables a suction to occur within the plastic tube, so the penis gets drawn up into an erection-like situation. It's kept that way by a soft rubber ring that goes around the base of the penis after the plastic tube's removed. Now, it really doesn't cause a very hard erection, and the erection the man gets is cold and blue because the rubber ring is stopping blood getting into the penis. But for some men it's enough for them, and they're satisfied to use that. All those things are really ways of obtaining an erection. They're not actually fixing the problem, they're just ways of a man getting an erection, and many of them may be suitable for some patients. But currently the only way we have of fixing erectile dysfunction is to put a penile implant inside the penis. A normal erection means that blood goes into the penis and fills up the spongy spaces inside the penis. The blood gets trapped in the penis, so the penis gets hard. What we do with a penile implant is we also have fluid go into the penis to make the penis hard, but that fluid is within cylinders, plastic cylinders that we put inside the normal spaces of the penis. So it's still what you might call a hydraulic erection, that is, fluid goes in, the pressure builds up, but it's now completely under the man's control. He can have an erection whenever he likes, as quickly as he likes, and as often as he likes. And that's really why a penile implant is the only way to fix erectile dysfunction.
Penile implant surgery. Your questions and answers with Dr. Christopher Love, urological surgeon, brought to you by fixED, www.fixed.net.au.